All right, well, we've been talking to lots of people here at the JIFU Rise 2025 conference, and it's been absolutely amazing. There's multiple reasons that JIFU is great and becoming greater. And one of the reasons right here and right now is, well, they call him Dr. Bill, but I'll say it, Dr. Bill Cimikoski. I believe I said that right.
Excellent.
Thanks so much for your time here today. You're having a lot of fun talking to everybody, and I know you talked a bit.
I do. In fact, I try to mention that just about every time I have the opportunity to be at an event like this, that the best part of my job is meeting people and talking and interacting with people. I've always been fascinated by meeting people and exploring what they have to, what everybody has a story to tell.
Right.
Everybody has a life, an interesting life, and a struggle and successes in their life. And I feel like we can learn from everybody. And everybody's got an interesting story to tell, and I want to hear about it. I want to meet as many people as I can.
I first exposed to you back in about November, and the health thing was for me. I was like, I don't know, I follow it, but this stem cell, the products that are coming out, and I'm a type 2 diabetic. I've been using it about 30 days now, quite honestly. And I'm noticing some differences, but before we get right directly in that, give the 30-second, like how you got started in the medical field, and then how you got to stem cell research.
Wow, that's hard to do in 30 seconds.
Well, whatever. You take as much time as you need.
All right, so I've always wanted to be a physician. Well, actually, no, I wanted to be a dentist when I was a kid. Let's back up a little bit. My parents were both dentists. My dad was an oral surgeon. My mom was a general practitioner, and I thought I'd become a dentist.
Right.
I changed my mind at the last minute. That's a long story. And decided to become a doctor. And then I really was very into sports and fitness and nutrition, had a lot of knee injuries, a lot of orthopedic surgeries, and I thought I would become an orthopedist and a sports medicine doctor. But then when I got to medical school, I loved emergency medicine, and sports medicine was a subspecialty of that. So I decided to go into emergency medicine with a subspecialty in sports medicine. But then as time went on, I got more training in sports medicine. I became fascinated with toxicology as well, and also critical care. So instead of doing a sports medicine fellowship, I did a critical care toxicology fellowship. And I did for 25, and then I did some trauma training after that. So for 25 years, I was a specialist in things that keep you alive. Poisonings, overdoses, emergency care, trauma. I never thought I would leave that field because I invested a lot of time and energy in it, and I became the expert of the experts. But then I learned about stem cells to treat my own needs because I never wanted to give up skiing. I'm a skier. I play a lot of other sports. And once I learned how well stem cells work to treat orthopedic injuries, I thought, why don't more doctors know about this? And why don't more patients know about this? So I made a commitment to learn how to do these treatments myself and spread the word. So I got the training in orthopedics. I became board certified in interventional regenerative orthopedic medicine, which is the specialty that does non-surgical orthopedics, which is what I do. I inject joints using a prolotherapy technique that's been around for many years, and I inject stem cells into joints to repair cartilage, tendons, ligaments, meniscus, labrum. And through the orthopedic world and arena, we then learned as scientists and doctors that we can use stem cells to treat many different conditions. You name the systemic illness, multiple sclerosis, heart failure, COPD, traumatic brain injury, autism, GI complaints, Crohn's disease. There's been multiple, thousands and thousands of studies conducted on IV stem cells to treat all these conditions, and they work astoundingly well. It should be the first line treatment for all these conditions. But then it's not, because a lot of people don't know about it, and there's a lot of corruption in the world where a lot of insurance companies and other people that help run or make a lot of money, like Big Pharma, they will.
That's a whole documentary.
They will stifle it. So now it's my job to get the word out, and I'm very ecstatic to be a part of the JIFU team.
Yeah.
Because, like you said, they've got the infrastructure, they've got the corporate leaders, they have the boots on the ground. All the affiliates for JIFU are now going to get the word out with me of how great stem cells can be to treat many different things.
I had never heard about it until JIFU, so I mean, I'm grateful for JIFU for a lot of things, but now this, and so I know how it's been working for me. I've been feeling better, in different areas, and there's a lot of things I need to fix. But you talk about diabetes. Why is STEM? And then of course you got the 3D STEM Plus and Omega. Talk about those and how that's going to help me.
Well, diabetes in particular. So I treat a lot of diabetics. There's been thousands of studies completed using IV stem cells to treat diabetes. In my practice, I also treated many people with diabetes.
Okay.
And it can dramatically improve the hemoglobin A1C. I can give you some examples where someone started off with a hemoglobin of A1C of 16, and after one treatment with stem cells, it's gone down to about a 7. So it can have astounding benefits on diabetes. And also the complications associated with diabetes.
Right.
It can cause retinopathies and vascular problems as well, heart disease. So stem cells can help all those things. The STEM product and the omega-3 that we just introduced yesterday, that will help to lower the risk factors for the things that cause early death, or the leading cause of death after the age of 40 are heart attack and strokes. And what are the risk factors for that? Well, high cholesterol is one of those.
Yep.
So the STEM will lower the omega-3 will lower your cholesterol, and it'll give you the right types of fats. The HDL is the good type of cholesterol. The LDL is the bad type of cholesterol. So the omega-3 will help diabetics make it less likely that they're going to die of a heart attack, and help with their cholesterol.
My wife will be happy with that. And that's great, and I'm totally confident in this. Why do I got to take it though? Why doesn't my body just do this for me?
Well, your body is trying to make. First of all, everyone's got stem cells. That's what your body uses to repair itself. When you cut your skin, when you have a sprained ankle, a tearing of a ligament, if you were to have a heart attack, that is some damage to your heart muscle. Your body tries to send stem cells to that area to repair it. And some things it does a very good job of repairing, and some things it doesn't. Skin is a very good example. If you cut your skin, even if you don't put a bandage on it, it's usually going to heal pretty quickly if it's not too deep. But other things like cartilage has not as rich a blood supply, and not as many stem cells go to that area. So that's a disease and a problem that we all have as we get older. No one's immune to it. So but what can we do about it? When we can increase our stem cells, either through the STEM product or by getting stem cells, you can get it injected or get it through the IV, then you're going to be delivering thousands of times more stem cells than what your body will send in. And so you have a much better chance of actually repairing and healing that area.
Right. That's great. One of the other products I want to talk about, collagen. I use that as well, and my wife says my hair's softer, so I take lots of that. But one of my favorite products as well is the Live. And I really enjoy that for a lot of reasons. Talk about that before we wrap.
Well, the Live has two great ingredients. It's got resveratrol and glutathione. Those are the two hallmark of that supplement that you can drink. And they're both very, very good for longevity. They make it less likely that you're going to get cancer, but it also does things that are very good for getting rid of toxicity. The glutathione is excellent at detoxifying the liver, for example, but it also has a lot of other properties that can help with cognitive functioning. Resveratrol also can help with improved joints. And improve with the cartilage and things like that. So it also has a lot of other super fruits and minerals, vitamins, things like that. But I think that really what sets the Live product apart from other things is really the glutathione and the resveratrol. Those are the two key ingredients. And what they can do are pretty amazing and miraculous for the body. So that's one of the mainstays of anti-aging medicine.
I love it, and I put all three together right now, and I know I'll be looking at adding some more in there as well. So combined, anti-aging and it's just a good thing to do for your body and your health, right?
I'll tell you, I've had about 2 or 3 questions just in the last hour that were very similar to yours. And just the lady I was talking to recently said, if I take the STEM product, the STEM, am I going to notice anything right away? Or am I going to notice any difference? And my answer to her was, when you increase the activity of your stem cells and increase the amount of stem cells your body is making, then you may very well feel those improvements. You might recover from injuries better. It might help everything feel better. Sometimes it's difficult to have, if you don't have a control, some comparison, you might not know what it's doing for you. So you have to have the faith that it is doing these things for you. And sometimes you will notice things are much better. Your recovery from different ailments will be much better. So you will see some things noticeably with the stem. Some of them may be subtle. The collagen 3, though, the Gen 3 product, which is mainly collagen, collagen 3, collagen is so important for many things in the body. It's the most abundant protein in the body, and it is like the ingredient that's most helpful for cartilage, skin, your hair, nails. And those things, especially if you're younger, some of these anti-aging things are great for you and me because we're over the age of 50, right?
That's right.
The younger people, 20 and 30 years old, they're like, well, do I really have to care about that right now?
Not right now,
But the Gen 3,
over time,
over time, but the Gen 3 is something everybody can feel in the improvements right away.
I even simply, my skin complexion, etc. My hair grows faster. Everything's wonderful.
Well, the big thing is muscle building. So I treat a lot of the best athletes in the world. They all do collagen. They don't do a lot of other things, but they all take an abundant amount of collagen every day because they know that helps them build muscle mass. So when you're younger and you're trying to be more fit, even if you're not that, you don't care about losing your hair or your skin, everybody wants to be stronger. So collagen 3 will definitely give you some more strength. Collagen 3. I said it again. Let's call it collagen 3 from now on. But Gen 3. But collagen is the main ingredient.
Wonderful. Dr. Bill, thank you so much. I'm so grateful for you and your team and everything you do. And where can people find you if they want to find out more?
Well, I have a website called utahstemcells.com, and I love it when people follow me on social media. I love interaction. I have a utahstemcells.com Instagram. But I also have Bill Cimikoski, MD. And right now we're populating the Bill Cimikoski, MD, so look for me on that.
Will do.
And then also Utah Stem Cells.
All right, thanks again. All right, there you go. Dr. Bill himself, grateful for his time, grateful for JIFU, and everything combined that is making JIFU and everyone involved a great success. Thanks for watching.